Well, good afternoon and welcome to our first unplanned media briefing. And it's unplanned because we had some very good and exciting news last night that we received that I'm sure a lot of you heard of over the last few hours. The state approved our request to accelerate our move into stage 2 of the recovery. And that's one of the biggest leaps I think that we've seen so far. It certainly modifies on-site dining and in-store retail shopping, and we're going to share with you more details in regards to what that actually means. This is really good news because it's going to allow the citizens of San Diego County and certain segments of our community to get back to a little bit more of a normal lifestyle. We certainly look forward to future reopenings, but what has been announced now is going to certainly provide jobs and allow people to boost the economy by supporting their local businesses. It's also a huge morale boost for all of us in this region who have missed dining at our favorite restaurants and visiting small businesses that have been part of our daily lives. I want to acknowledge the tremendous job that our county staff did. Certainly Helen Robbins-Meyer, our Chief Administrative Officer, leading the effort. All the folks here at the Emergency Operations Center have done a fantastic job in compiling the information. But the real hero of this effort, in my opinion, is Dr. Wilma Wooten, our Public Health Officer. She's the one who worked hand in hand with the California Department of Public Health to share with them what we're doing and the track record that we have developed over the last few weeks, last several weeks, in regards to helping to contain the coronavirus. We've been preparing for this moment for weeks now, and we have been working closely with the San Diego chapter of the Restaurant Association. And in a few minutes, you're going to be hearing from Jeff Rossman, who is the president of the California Restaurant Association San Diego chapter president. Last week, our Department of Environmental Health sent out guidelines to all permitted food facilities in the region. That's just under 16,000 different establishments. The information that was provided to them basically let them know what they could start doing to prepare their facility, such as like flushing water lines, sanitizing dish machines, and checking cooler temperatures. Earlier this week, the department sent out COVID restaurant dine-in guidance and protocols that operators are to complete and post on site. With the news of the state approval breaking late last night, the department quickly got messages out via its stakeholder partners and sent another all-restaurant facility email letting them know if they had completed and posted their protocols, they could reopen as soon as today. As a result, this morning, some restaurants were able to open for breakfast. That's great news, but it only brings up an important point that we have to keep re-emphasizing, and that is that we are seeing this success at this point only because we've all been working together. As you head into the weekend, please keep that in mind. We want you to support our local businesses and certainly our restaurants and shops, but check first to see if they are open and realize that there may be limits on diners and there may be waits. And please remember to social distance if you are waiting, and reservations are encouraged. We've reached this important point in our recovery because of you, San Diego. Your efforts to avoid large gatherings and take measures to slow the spread of the virus allowed us to better control the pandemic. And as a result, we can get a little breathing room from the lockdown and move forward. So yes, you can feel good about this and certainly go out and celebrate a little. But we cannot declare victory yet. The truth is the threat still exists. The virus is still out there and we must continue taking safeguards when we get out in the public. Let's not lose our hard-earned gains, and we certainly don't want to let our guard down and risk a resurgence of the virus that could put us back to square one. Now to hear more about the details about last night's decision and what it means for all of us, let me introduce Supervisor Nathan Fletcher.
Thank you, and good afternoon. As everyone knows, or should know by this point, San Diego County received the green light from the state of California to advance all the way through Stage 2 reopenings. This means in-person restaurant dining is now allowed, and in-store retail shopping is now allowed, with some modifications, but most importantly, with protections, both for our employees and for their customers. But it's important that we take a moment, and it's natural to understand that as soon as we take one step forward, there's an eagerness to take additional steps forward. And the simple reality is we are not there yet. We have just 12 hours away from getting the green light to move into Stage 2. Most of those businesses are working on coming back online. The plan has been submitted to the state to move forward, and it's not surprising to hear a number of other industries who are ready to go and ready to move forward. But we need to take a pause. We need to successfully implement Stage 2. We need to allow our businesses to get open. We need to allow customers the opportunity to get out in the adapted environment and mindset. We need to continue to monitor our public health data. We need to continue to responsibly move through our reopening phases. It is going to be gradual. It is going to be a step, assess the impact on our public health settings, understanding that the signs of spread, there is a lag behind the actions that take place, and so it is going to take a continued patience on our part. The most important thing as we go through our reopening is that we protect public health and we ensure a smooth economic recovery, which means that we continue to move forward. That's not only in our public health interest, that is in our economic interest. And so let us show all of California that just like we've been a model county for every step we've taken, let's be a model county for implementing Stage 2. Let's not get ahead of ourselves. Let's do this right. Let's stay safe. We all have our part to play, both our public health department, our county governments, our cities, our partners in the business community, and each and every one of you San Diego County residents who are out there. We have our part to play, that we've shown that we can change our actions to protect lives, and now we have to adapt what we've been doing in an effort to continue to protect lives. We also ask that as we go through these reopening phases, we ask for your continued patience. When we have an industry that we are able to move forward with reopening, in this case, dine-in, restaurant, and in-person retail, we try to provide broad parameters. We work with our business sector partners to get feedback and input, but there is no possible way to anticipate or account for every possible unique situation or scenario that might arise. And so as we get questions for things, we will work on them, we will address them, we will try and get answers. But most importantly, we are moving forward collaboratively, taking into account the safety of workers, the safety of customers, the dynamic nature of businesses, the important role that public health plays, and bringing all of these together in a collaborative spirit to ensure that we can move forward together. Now more than ever, as we move into these new phases, we need the public's continued commitment. We need to continue to see widespread adherence to the things we know that will stop the spread as we get out more. Those are things like face coverings, temperature checks, hygiene, and physical distancing. As we move into activities where there is more exposure with more individual people, our individual choice to adhere to these actions is what is going to keep us on a path moving forward. I have full confidence in our restaurant and retail industries that they will abide by the guidance that's been put out, that they will do everything possible to make sure that they're creating an environment that not only protects their employees, protects their customers, but also ensures that as a region we can continue to make progress as we move forward. Right now, safely reopening, responsibly reopening, understanding it will be in phases is our highest priority as we move forward. Now I'd like to share with you a couple slides that will walk through some things that you can expect and anticipate as you go into these newly reopened businesses, and we'll start with dine-in restaurants. The first part is all dine-in restaurants must complete and post the restaurant operating protocols. Those are found at our website, coronavirus-sd.com. We've been working with our partners in the restaurant industry for a significant amount of time to prepare something that addresses their needs but also accounts for the public health concerns. And some things that you can expect as employees is temperature and screening checks when you come to work. Employees with symptoms cannot work, whether that be any of the symptoms you have or that be a fever when you show up. All tables in restaurants will be 6 feet apart or more, or have physical barriers between them. You will see signs reminding customers to physically and socially distance. Employees must wear face coverings. Customers must wear face coverings except when seated. There still is no self-service, salad bars, self-service type entities. We are encouraging reservations, and we are also encouraging expanded outdoor seating. You can go inside for in-dining. That is allowable. There's a series of things that will help protect us, but we are not only encouraging reservations, but encouraging outdoor opportunities as well. For in-store retail, you can see, again, complete and update the safe reopening plan. There will be signs posted for both employees and customers not to enter with symptoms, temperature and screening checks, just like for restaurants and other reopened businesses for retail employees. Employees and customers must wear face coverings, and we are limiting the number of customers to ensure physical distancing remains in effect throughout in-store retail and in-restaurant dining for separate groups. Next, we'll go to the things that are not yet there. Hotels, Airbnb, gyms, fitness centers, hair, nail, tanning salons, pools, beach parking, sitting, religious services. These are things that the state has alluded to are coming soon. These are things that definitely fall into stage 3. These are things we know are important to folks to get going, but it is vitally important that we cannot do everything at one time. We have to take a step, monitor the impact, take another step, and hopefully if we do it right, that allows us the continued positive trajectory and continue to move forward. At this point, I'm going to quickly go through our daily charts. Since we're here today. Another really good day of testing, 4,722 tests. You can see our 7-day average is now up over 4,000 tests, more than 120,000 conducted. Over 300 contact tracers. That is a jump from what we've previously reported. We want those numbers, all of those numbers, to continue to increase. And then you can see in our treatment, our public health motel rooms, and our cumulatives. Today we're reporting 175 new positive test results out of the 4,722. This is a 4% daily average. Again, day-to-day numbers are not as important as the overall trends. A little higher than our 14-day rolling average, but certainly statistically right there in line with where we've been. And again, you can see represented here the continued increase in testing, that step up that we've done from the range of 2,000, 3,000. Now we're in the range of 4,000. Our next step is to get to 5,000, which is our initial goal that we want. On hospitalizations, COVID-related, you'll see here the number of ICUs down a little bit, number of overall COVID hospitalizations up a little bit, but both of those numbers are well below the total system capacity, which you can see here represented on the next chart, which is our COVID hospitalizations at 404, the non-COVID on top of those, and the dotted purple line at the top representing our current bed capacity in our area hospitals. At this point, I want to introduce a good partner and friend. We've been working with Jeff Rossman and his entire team at the San Diego chapter of the California Restaurant Association throughout the duration of this coronavirus episode. We know that they want to get up and running. We know that they want to do it responsibly in a way that protects our customers, protects their employees, and begins to get a vital component of our San Diego economy back up and running. And so we're pleased to have with us here the president of the San Diego chapter of the California Restaurant Association, Jeff Rossman.
Thank you, Supervisor Fletcher. Woohoo! No, seriously. I can tell you with 100% certainty that not only restaurants but small businesses are extremely ecstatic today. We've been working, as Supervisor Fletcher said, we've been working tirelessly for weeks now preparing for this day. Feels great to be here. First and foremost, I'd like to thank Dr. Wooten, the entire Department of Environmental Health team, county supervisors, Mayor Faulkner's office for their hard work throughout this crazy, crazy time. We've been fighting to get our restaurants and business back on track and open, so thank you very much. On behalf of the CRA and all restaurants and small businesses, we appreciate it. All of our restaurants are trying to open up swiftly, also ensuring employee and customer safety. which are paramount. I can't stress that enough. A lot of the items that Supervisor Fletcher and Supervisor Cox went through, we'll go through again and reiterate from the restaurant's perspective, but we don't want to go swiftly. We want to encourage people to take their time to go out to restaurants. Some restaurants opened up this morning for breakfast, this afternoon. Others are taking their time. You'll see various stages of reopening over the coming days and weeks. Both my restaurants, Terra and Buns, are planning on opening the first week of June, so we're taking a little bit extra time ourselves. Many restaurants will continue to offer takeout, curbside pickup, and delivery as they've been doing so. So make sure that you give yourself a little extra time. Parking lots might be crowded. Stay patient, please. So let me explain a little bit about what you'll see. Dining experience will definitely be different, no doubt. I'm sure you've seen what's been going on around the country. Fortunately, with our climate, you'll see more outdoor dining parking lots and sidewalks. I know for our restaurant, we've been talking about pushing out some tables into the parking lot. Distance tables on existing patios, tables and chairs further apart, barriers between tables, definitely less contact from serving staff and staff wearing masks. The bars and restaurants, those will only be used as an extension of the dining area. So bartenders will hand you your food and drinks and then walk away. They won't be able to stand there, tell jokes, and converse like normal, so you have to be patient during this time. We thank you in advance for your patience while we navigate this new normal. The restaurant menus may look a little different as well. Physically, the wine lists and the cocktail lists, cool-looking menu covers will be swapped out for single-use paper, black and white perhaps, or in some cases, online. Technology has changed everything these past few weeks. I can attest to that. For online ordering, we had to pivot to a model that wasn't the best, but it's working. Tableside ordering, contactless payments solutions, that's what we're encouraging, that's what we're trying to do if possible. Your favorite dish also might not be there on a restaurant menu. Supply chain has had an issue. I'm sure you've seen in the grocery stores a lack of product, a lack of protein, and we're having the same issues at the restaurants. So be patient while our supply chain needs a little bit of time to ramp up. The dining public can help by complying with all of the rules. Please don't come in if you're sick. Dine with your household only. Make sure to check the restaurant's website for sure before you go there for their status, if they're open, what they're doing. Also, to make reservations or add yourself to the wait list. Treat your reservations like an appointment and be courteous to the business and the other guests waiting, because we have less tables. Obviously, we have less people to serve you. We have less people that can come into the restaurant, so be courteous to people that are waiting. Make sure you wear your facial coverings, and definitely read and comply with the posted signage before you enter. Supervisor Fletcher mentioned the protocols. All the protocols, we have checklists that will be printed, so you're more than welcome to read everything that the restaurants are doing before you enter. Please make sure to give yourself a little extra time so you comply with social distancing protocols. I'm sure you've seen the casino openings and lines and lines and lines. We don't want people queuing. There's going to be one-way entrances possibly, one-way exits, social distancing stickers, directional signs on floors. Wait in your car if possible until your reservation time, or if you've received a text notification that your reservation is ready. We don't want people to be queuing in lobbies or around the doors. As you may or may not know, San Diego Restaurant Week is put on by our chapter, and we're planning on a community-wide Restaurant Week later in September, late September, by inviting not just our members, but all restaurants in our region to participate. We encourage all San Diegans to go support our restaurants now, but for sure make a point to go out during Restaurant Week. Once again, we can't stress enough how your safety and the safety of our team members is to our restaurant community. I can't stress that enough. We've been working tirelessly again with the health department for 6 weeks on these protocols to make sure when this day came, we would be ready to reopen safely and with the utmost concern for everyone's health. Thanks again to the county supervisors and the mayor's office and the Department of Environmental Health for working with the California Restaurant Association to make our community safe. We'll see you in the restaurants. Thank you.
So, good afternoon, everyone, and thank you for joining us for this afternoon's briefing. The global, national, and state statistics, as always, are based on the data from the Johns Hopkins dashboard, which was obtained at noon today. Globally, there are over 5 million positive cases, including almost 330,000 deaths. Nationwide, the United States is reporting almost 1.6 million positive cases, still 31% of the global number, and includes almost 94,000 deaths. Statewide, California is reporting over 86,000 positive cases, including 3,501 deaths. Today, the County of San Diego is reporting 6,315 cases, which is 175 more cases than yesterday, and includes 241 deaths, which includes 11 new deaths reported since yesterday. The age range has not changed, as young as 3 months to 101 years of age. We are up just 1% for the age range of 20 to 49 years of age at 52%. And the male and female or gender demographics is 50% for both genders. We now have 1,183, or 19% of all cases hospitalized, and this includes 354, 6% of the total, have been admitted to the ICU. And just to remember, as a reminder, these are cumulative data. This number, the ICU number, is 30% of the total number of those hospitalized. The 241 deaths represent approximately 4% of the total number of cases, and of the 11 additional deaths, the dates of these deaths occurred between May 14th and May 19th. The age range is from 51 to 100 years, and of the total, 44% are female, 56% are male, and 232 of the total had underlying medical conditions, which is 96% of the total deaths. Of the new cases that are reported to, or rather, in addition to the 232 that has underlying medical conditions, 8 now have no underlying medical conditions. Regarding race and ethnicity for all deaths, we have data for 95% of the 241 total number of cases, which is 239. And the number has not significantly changed from yesterday, so we will not go through the individual statistics, but these data can be found on our website, which is at the bottom of the screen and in the sign in front of me. I again would like to express my sincerest sympathies to the family and friends of those individuals who lost their lives to COVID-19 that we reported today. In regard to reported outbreaks in congregate and community settings to date, we have had a cumulative total of 73 confirmed active outbreaks. Of these active outbreaks, 50 are in congregate facilities, and we have 1 new outbreak reported since yesterday. This brings to a total number of congregate cases at 1,391, which is about 22% of the total number of cases, and includes 119 deaths. We also have 23 active outbreaks in community setting locations, which includes 266 cases and 5 deaths. Now, as you now know, the County of San Diego's COVID-19 variance attestation form for implementation of an accelerated stage 2 in the California's roadmap to modify the stay-at-home order was approved last evening by the State Health Department. This was a tremendous lift, working over the weekend to provide information for the original attestation form, and on late Monday, we received the revised attestation form. Before that, we had the opportunity to meet with all of our hospital CEOs at a regular weekly meeting to share draft information. The revised attestation form was completed and submitted on late Tuesday after our board meeting and presentation to our Board of Supervisors. An unsolicited proposal for a pilot program to test implementation with significant limitations to reopen moderate-risk businesses in Stage 3 of the stay-at-home order was also submitted, and we do not at this time know when a response will be provided. So in closing, I would just like to spend a couple of minutes to review information about our hospital capacity, which has been the subject of several questions that we have received. Supervisor Fletcher has gone over our hospital capacity, but I just want to review this slide. At the very top, the purple line, that shows our total, or rather our current bed capacity for all of our hospitals across the county, which is about 24 hospitals, and this number is 6,084. The purple area is what we've identified as our 20% cushion, and that is a total number of beds at 4,868. Just focusing on 520 at the very far right, you will see that for 520, which was yesterday, our total number of beds was 3,824, which is 63% of our total capacity. That included 404 COVID-19 hospitalizations. So this slide shows that we currently have, in addition to those individuals that are hospitalized, we have 37% available capacity for surge. In the next 4 slides, what we want to focus on is ICU bed occupancy and capacity. So this first slide shows our daily number of COVID-19 ICU admissions, and for May 20th, we had 150 cases. So that is the salmon colored at the very bottom. In the next slide, the blue bars add additional IC beds with non-COVID-19 admissions. And for May 20th, the total overall is, including the non-COVID IC admissions, is 426. In the next slide, this line shows the full capacity, the total number of licensed ICU beds in San Diego, which is 799, just shy of 800. And then in this next slide, the gray line is the current ICU bed capacity, which represents the number of adult ICU beds currently on site at all of our hospitals. This includes staffed and unstaffed, occupied and occupied. And again, that is the gray line. And lastly, the green line is the percentage of adult ICU beds occupied, which is 65.3% for May 20th, also showing that we have 35% capacity for our ICU beds. So in closing, we just want the public to know that we are monitoring all of our metrics, and in our plan, there are triggers that we will be closely monitoring to ensure that we are headed in the right direction, and it will help us to dial back on modifications that have been made. So this doesn't mean everything is heading in the right direction. It doesn't mean that we should be complacent, but it means that we should comply with the guidance that is currently out there for the various modifications that are being implemented. So we want to thank everyone throughout the county for your support as we expand our activities and open up our businesses. Now, please welcome back to the podium Supervisor and Chairman Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Brianna Gomez with East County Magazine. Please state your question. Brianna Gomez with East County Magazine. Can you please state your question?
Yes. Hi, yes. What is the correlation between high rates of COVID and the Hispanic community. Are there any differences in symptoms between people of color and Caucasian individuals? And what will reopening look like for minority communities?
Okay, Dr. Wooten, do you want to?
Are there any particular risks involved, and what specific targeting is taking place?
So that was about 4 questions, but thank you for those questions. So in terms of, as far as we are aware, everyone reacts differently to COVID-19. So I have not heard about any variance in response based on race and ethnicity, but everyone responds differently.
Okay.
The next question you had was about in businesses in the various communities. Whatever business qualifies based on the categories that we've announced, opens up. So there is no race or ethnicity flavor to that.
I meant, are there
What
any
do you mean?
specific concerns in reopening based on like a lack of information per se, or because the rates are so much higher in those communities, is there more of a risk of spreading?
Well, because of our sectors, we are trying to get, outreach to all of our various sectors, which includes individuals that are represented from across the county and across various diverse communities. So our goal, you are helping us to get information out. We have information on our website, and people certainly are welcome to call 211 if they have questions. And were there other questions? Was there another question that you had? Are you good?
Yes. What is the no? Yes. What is the cause of these high rates? Are we seeing? Is it a lack of access to healthcare, for example? I mean, has there been any type of correlation between the high rates of COVID infections and the Hispanic community, for example?
So just with the Hispanic community and also people of color and low-income areas, we know that those individuals have an increased risk. Not an increased risk, but have increased comorbidities, whether it's hypertension or asthma or chronic lung disease like COPD or any other compromised immune system type of conditions. Those individuals seem to have, or in many cases have a higher number of comorbid conditions, so therefore they are at greater risk, as well as our elderly, and I cannot ever forget to leave out our elderly population. They are at greatest risk for complications, which does include death from COVID-19 if they become infected. Thank you.
Thank you.
Just to add one point to your question, in a county of 3.3 million people with a diversity of geography, you're always going to have certain areas that have elevated rates of cases. That is natural, just like in the state of California, you have some counties have more elevated rates than others. And we do take that seriously, and we are doing everything we can to make sure we're supporting those communities that have increased cases. We're doing increased testing, increased PPE distribution, working with those healthcare systems. But that really drives home the point that we need everyone in San Diego County to really continue to be aware of the challenge that remains from coronavirus and continue to be very mindful of our actions when we go out. And in terms of those individuals that are at higher risk, our seniors and those with underlying health conditions, we still strongly encourage our senior citizens and those with underlying health conditions to exercise extreme caution, to be very mindful, ideally to stay at home to the maximum extent possible, because those are the individuals that are greater risk, and those are the individuals we want to make sure we provide the greatest protection to. But in general, the message to San Diegans throughout the county is we want to safely and responsibly reopen, and we believe if folks follow the things that have been outlined, we get good cooperation from our business sectors, that we can continue to have success as a region in progressing towards reopening.
Okay, let's go to our next question.
Matt Hoffman with KPBS, please state your question.
Hi, I just wondering if you guys have talked about an enforcement plan for regulations pertaining to restaurant and retail stores, or just curious what those conversations have looked like with local law enforcement.
Okay. Supervisor Fletcher is going to respond.
Thank you, Matt. All of the public health orders are enforceable at the discretion of local law enforcement, and that is the jurisdiction where the entity resides. But it shouldn't be the job of law enforcement to have to go out and enforce these measures. These are things that are put in place in order to protect public health. These are things put in place to protect our economic recovery and make sure it can continue. And I just want to add that when it comes to businesses in particular, I believe that the overwhelming majority of them will do the right thing. Because they want to reopen, they want to protect their workers, they also want to protect their customers. And we are in an age and a time where if it is not a safe environment, not only will the customers who are there leave, but they will utilize platforms like Yelp or Nextdoor to tell everyone else not to go there. And so we are relying on the cooperation of our business partners. We do have faith and confidence that they will do this responsibly. But in the event that there are bad faith actors, those can always be reported to the non-emergency line for local law enforcement and shared in other venues.
Gotcha. And then just to follow up, I'm just curious if you guys know how many reopening plans you've received from businesses under this expanded phase 2. Just curious if you have like a gauge of like how many.
In the early phases of this, we were asking businesses to send us a copy of their plan. We weren't approving them. But now that we are moving all the way through stage 2, we are not requiring them to submit them to us. They need to prepare them, they need to post them publicly, they need to share them with their employees, but they do not have to send a copy to the county.
Gotcha. Thank you.
Okay, we have one more call-in question.
Paul Sisson with the Union Tribune, please state your question.
Hi, thanks for taking my question. This has to do with hotels. We know that this current phase 2 broadening measure has to do with dining and with shopping. From what I heard you say earlier, it does not at this point pertain to hotels beginning to just fully reopen and start accepting as many guests as they can handle. Yet if you look online, you see a lot of local hotels and nightclubs as well running a lot of promotions right at this very moment, talking about come on in for a Memorial Day celebration or stay or what have you. So I wonder what the county plans to do about hotels and nightclubs that appear to be trying to reopen in some fashion this weekend.
Okay, Supervisor Fletcher will respond.
Thank you, Paul. Look, we would encourage everyone to follow the guidance, follow the public health orders. These are put in place not out of a desire to restrict what folks can do, but out of a desire to ensure that we have a smooth economic recovery. It's simply not possible to do everything at one time, and we have to do it in phases and stages. And so we understand the impact on businesses, but we're asking for continued compliance and continued help. As it relates to hotels, they're allowed to be open now for essential workers or for COVID-related functions, but that is it. And so we ask and encourage the continued compliance because we do believe it is what will help facilitate us moving through all these stages as quickly as possible.
Although I wonder, is there an enforcement plan? If indeed you see a bunch pop up this weekend, what's going to happen? What is the risk that these facilities are taking?
Well, the enforcement, like with all of the public health orders related to any business or industry, is at the discretion of the local law enforcement for that particular jurisdiction. Folks can feel free to report that through the non-emergency line, and that is the most appropriate venue to report any of these types of issues.
Thank you.
These next two questions deal with some of the protocols for restaurants and for retail stores, and Dr. Wooten will respond to both of those.
Yes, this first question is from Shannon Handy with CBS 8. I have a question about bathrooms and in restaurants in particular. What are the protocols? Do stalls have to be moved, paper towels instead of air dryers, or a certain amount of people allowed in? In other words, are there restrictions or changes to restrooms now that businesses will need to adhere by to reopen?
So there are 4 strategies that we are recommending that's in the health office's orders and that are recommended to help us be successful at opening back up essential and reopened businesses. The first is hygiene and sanitation. So there is nothing that needs to change or be different except that based on the frequency of bathrooms being used in, specifically, make the determination how often it should be cleaned. So they should be cleaned as often as they are utilized. Previously, in some of our social distancing and sanitation protocol, we said every 2 hours, but there is a caveat, as needed. So again, it's based on the frequency of use. The next thing is social distancing, then facial coverings, and then the fifth is adherence. All of these strategies are only as good as our behavior and culture of adherence. Anita, there was another question, so I answered the first one about sanitation.
Okay, let me see. Our paper towels instead of dryers, certain amount of people allowed in at each, at a time.
Well, usually, only, if it's a single bathroom, only one person uses it at a time. If there are multiple stalls, there's no need to make any changes there because the stalls are separated. So again, we would urge you to use best practices and common sense and continue as you have done before. Washing your hands, however, and increased sanitation based on the utility of bathrooms and stalls will be important.
I think someone had asked about urinals. Those will be up to the
Same
discretion.
thing, same recommendation.
Okay,
Yes.
and I think you've answered most of these from Claudia with Univision.
Oh, I'm not a guy, but I understand what the question is about the urinals. So the separation. So if you have multiple urinals, or if it is one urinal, that's not an issue. But if there's multiple urinals, just make sure that there is 6 feet separation between individuals.
Thank you, Dr. Wooten.
Sorry.
No, I appreciate it. And for Claudia, she just wanted a little bit from Univision, a little bit of specification on retail shopping and what the stores will look like. Are the fitting rooms okay? Less fitting rooms? Should the clothing be spaced apart? Just a little bit of clarification on fitting rooms.
Nothing should change with clothing. Nothing should change with fitting rooms except the frequency, the cleaning, making sure that you are cleaning them between use. That would be important.
Okay, and I have a question from Lindsay Winkley with the Union Tribune. It's in the attestation application. The county identified very specific metrics designed to let county officials know when the county's reopening should be slowed down or even paused, and they can be found in the triggers for adjusting modifications table. Could you please elaborate on how important those metrics are and how seriously the county plans to stick to those metrics as we continue to progress through stage 2?
So those metrics are very important. As specified, they are triggers. So because we are allowing people to go back and resume some semblance of normality, we have to be able to monitor if we see more cases, more outbreaks. So those metrics that we have identified as triggers are serious, and we will be monitoring them frequently, every day. And many of that information we already monitor on a daily basis. So it is serious, and we will take it as such.
Thank you, Dr. Wooten.
Well, that completes the questions for today's special media briefing. We will be back here tomorrow at 2:30. Just a reminder, we will not have a media briefing on Saturday, Sunday, or Monday, but we will pick it back up again on Tuesday. Again, we are really happy to see that our accelerated plan for stage 2 was approved by the state of California, and we hope people over the next few days will have a chance to go out with the proper mask coverings and social distancing, and maybe go out to your favorite restaurant. And you know what? If you do that, leave a big tip. These folks have been waiting a long time to get to this point. So we'll see you tomorrow at 2:30. Thank you.